One of the greatest strengths of the program is the breadth of experience. We have all of the major areas of orthopedic knowledge covered. You don't have to go to other places, other programs. It's all right here. And not only just right here, but we have multiple surgeons really in every area. So you get different ideas, different techniques, different trains of thought. So I think just the breadth of knowledge, I think that is to be learned here is fabulous. I think one criticism might be that a lot of our attendings train here. So Buffalo being a very, I don't know how to say it, Buffalo-centric program, meaning people who come to Buffalo love Buffalo and they never leave. So that's both good and bad in that we want to bring in new ideas. So one way we really address that is we, of course, recruit other surgeons from other areas, but we also make sure that our faculty who have trained here have gone on to do fellowships elsewhere so that they've learned different ideas, different techniques that they're then bringing back here so that we don't get stale, so to speak. I think probably number one is a hard worker. We like to be busy, we want to be busy, and we are busy. So that's important. I mean, you got to love orthopedics because we all do, and that's what makes it a fun experience and makes it beneficial for everyone's training. And just got to be collegial and a team player. And I think you'll probably say that of any really orthopedic residency, frankly. But even more important here, I think, because of the amount of work that we do and the amount of cases and such to partake in. That's a tough question, I guess. Maybe just someone who doesn't work well with others. I think that's probably a bad fit for almost any job, though. Frankly, in today's world, it's a very collegial world and takes a lot of teamwork in any area of medicine or otherwise. So that would certainly be a problem. Otherwise, I mean, we have a bunch of different personalities and, we work together, we get along, and we, just have a good day. Many of them do. Some kind of full mentorship. Our orthopedic oncology, for example, is just one-on-one. So a 10-week block with Dr. Keekley, and you are with him for 10 weeks. Same with Dr. DeQuinn and upper extremity, but really shoulder arthroplasty. And other rotations are more of a partial mentorship where there might be 3 residents and 3 attendings. Like this is kind of how the pediatrics rotation is, where you're with us for 10 weeks, but you may switch between attendings. Usually it's kind of week by week. So it's kind of a mentorship and kind of not. More than an opportunity, it's really a requirement and a mandate. We expect our residents to help us teach the medical students, just like the residents should expect us to teach them. And the URC requires it, and the ACGME requires it as a part of their education. So we regularly have training sessions with the medical students, formally even before they're on 3rd and 4th year rotations, and then also, of course, when they're on rotation with us, the residents are expected to teach them. Well, I think I don't know the number offhand per se, but a lot of, myself included, have done residency here in Buffalo. I think there are good and bad about that. We've taught some of the limitations of that and how we've tried to combat that. But there's good in it too, in that there's a lot of connections within the community, within the healthcare systems, getting access to whatever you may need. It's a nice network to have and know within town. So I think that's probably the main benefit, as well as just kind of continuity of care of patients and being able to work with the healthcare systems, I think is a big. Yes, there is a minimum requirement just to go backwards. That's a little in flux, but generally we like to have 2 projects that you see through from start to completion, whether it's submission of an abstract, whether it's presenting a poster at a meeting, something of that nature. We used to do 1 bench work clinical science and 1 or basic science and 1 clinical study, but now we kind of will let you choose your path and decide what kind of studies you want to be involved in. We get you involved very early. We have our newly developed intern boot camp, which is the first 4 weeks of your internship, and we introduce you to all the research department because we have a lot of resources dedicated to that so that you can get involved and hop right in before you even realistically start your residency. In fact, one of our interns this year reached out to us before they even started to get involved in research. So that's great. We encourage that. We do have 2 dedicated research blocks, one during your 2nd year and one during your 3rd year. They're each 5 weeks to really immerse yourself in the lab. If you really need to get in there and do a basic science project that you're interested in, you can be in the lab 8 hours a day or 12 hours a day or how many hours a day you need to be in there to do that sort of work. So it's important to us, it's important to what we believe is proper orthopedic education to at least learn and understand the literature and research process, even if that's not going to be a big part of your practice. Definitely want to, and I would say that is a big plus of this program that I can speak to personally. I went straight out of residency into the Navy and functioned as an attending orthopedic surgeon right off the bat without any fellowship training and was very comfortable. And I think it's important, and what you should expect from your residency program is you are trained to be an orthopedic surgeon, and you know the framework of orthopedic surgery, and then whatever you decide to specialize in to get that extra training, you can jump in at fellowship and be ready for that. They don't need to train you to do the simple orthopedic surgery. They should be training you to do the very complex, specialized fellowship level things. So my example of that I use when I talk to our residents is I did my pediatric fellowship. I went there and pretty much all I really did surgically was scoliosis and hip osteotomy. I didn't need to learn how to do a tarsal coalition or a simple fracture or simpler cases. I just wanted extra training on the complex stuff because I was already prepared through residency. So I think our residents are ready to be orthopedic surgeons. You could be a general orthopedic surgeon if you so chose. But most people do fellowships in today's world, and I think it's because they find what type of orthopedics they want to do. Each hospital is a little different. The level 1 trauma center, ECMC, of course, there's more in-house call. It's busy, it's 24 hours, and the trauma doesn't stop. So in-house call at the trauma facilities, some of the more outpatient-centered locations like Buffalo General, where there's a lot of arthroplasty and spine procedures, that's more of a at-home call situation. So it just depends where you are, but a little bit of all flavors, realistically. Right away, we're busy. There's lots of attendings. We have, I think, about 30 attendings on staff now, and we don't even have that many residents. So there's lots of opportunities to get in the operating room. We like the residents to have a graduated autonomy model so that you get in there when you're young and in more of an assistant role and start to learn how to operate and get taught how to operate so that you can get more independent throughout your training. I think, unfortunately, you can't gain experience without experience. We certainly have our arthroscopic skills lab and our skills lab at the medical school that we try to, or that we do encompass education in early. But we also believe in getting residents in the operating room early so that they can learn proper techniques from the attendings so that they can become surgeons in a graduated fashion. Busy. We do place an emphasis on also learning not only how to operate, but who to operate on and how to take care of them after their surgery. So we make sure that the residents have time in the office and clinic setting, but certainly there is a lot of operative experience, both for outpatient procedures as well as trauma procedures. So we have fellowship programs in 3 areas. Sports medicine, we have 2 fellows in that department, and we have, I'm just counting, 4. We just hired a new sports medicine surgeon as well. So we have way more sports medicine surgeons than fellows. So we have a rotation schedule to make sure that the fellows don't impede the education of residents, and they're really never co-scrubbed unless there's something super interesting that you're only going to see once in a lifetime type situation. Same could be said with arthroplasty. We have an arthroplasty adult reconstruction fellow, but we actually just added 2 arthroplasty surgeons. So there's plenty of workload to go around there as well. And we also have a hand fellowship with 2 hand fellows and lots of hand cases to go around. So really, we don't feel that the fellows ever really impede the education of the residents, or we wouldn't have them because the residents are ultimately the most important. So there's really 3 main teaching hospitals and then a bunch of outpatient surgery centers. The first kind of most noteworthy one is very likely ECMC, or Erie County Medical Center. That's a level 1 trauma center. So that's a very busy, mostly blunt motor vehicle accident type trauma, some penetrating trauma, but lots of trauma. So that's where you learn your bread and butter orthopedics, because how did orthopedics start? Orthopedics was about fixing broken bones, and that's what you're going to learn how to do at ECMC very quickly. We also have a children's hospital where we have 4 full-time attendings and lots of pediatric specific, not only trauma, it's a level 1 trauma center for children, but scoliosis surgery, pediatric sports medicine, foot and hand pediatric surgery, pretty much the entire breadth of pediatrics. Then we have Buffalo General, which is more of the inpatient arthroplasty and spinal procedures are done there. There's spine trauma as well at ECMC to circle back. But a lot of the more elective arthroplasty or elective spine surgeries are done out of Buffalo General. And there's other things. There's foot and ankle there. There's foot and ankle at ECMC. I mean, it's all kind of interspersed and kind of collegial. Otherwise, there's a bunch of outpatient surgery centers as well, mostly for sports medicine, but other smaller procedures. For sure, extensive opportunities because we pretty much within our department cover all the local sports teams. Bills and Sabres at the professional level, UB, of course, at the college level, but even a lot of the other colleges around Western New York, we cover pretty much every sport you can think of, and also provide coverage for the high school teams as well. So for sure, yes, there's a lot of that to go around. For sure, of course. So every year we have a resident and faculty ski and golf day, and that's a day that we have biannually that we all get together and just enjoy ourselves, nice collegial environment, talk and have a nice time, have a dinner, all that good stuff. We also, in the summer, we definitely take advantage of the good weather. We always have, a couple get-togethers each year at, sometimes it's Tammy's house, and sometimes it's a program director's house, and sometimes it's Dr. Bowen's house, and sometimes I mean, it could be anybody, but we always have summer get-togethers. And I'm quite certain there's resident traditions that I don't know about and don't want to know about. We had some when I was a resident, so we can just leave those be, but sure, of course we have traditions. One thing we're really interested in pursuing is really developing our skills lab more and the use of it. So right now, certainly we use it for extra training and early teaching, but we want to kind of even develop it more to be an assessment tool to see how people are progressing during their training, to make sure their operative skills are in line with where they should be and they will be ready to be orthopedic surgeons, and we're interested in developing that. We also have just hired, as I discussed before, 2 new arthroplasty surgeons, both of whom are super eager and excited about research. And I think that will only develop and expand our research opportunities. Aside from that, I think our program is pretty stable. We don't have a lot of in and out. I think we have stable faculty, stable healthcare system, stable hospitals. So it's not much to worry about as far as that's concerned. That's a 2-pronged question. So a lot of the residents who don't have families yet live downtown in Buffalo. It's kind of a developing, maybe redeveloping city with a lot of lofts and fun places to live. The Elmwood district and all these various places where there's restaurants and kind of a vibrant atmosphere. And then there is the more traditional family setting, and there's suburbs everywhere. So there's literally, you can throw a golf ball into 37 different suburbs anywhere you are in Buffalo. So that type of family usually has a little house with a little yard, and they live in the suburbs. And then you have kind of your single crowd that tends to be more downtown. Buffalo's great. It's like a small, big town. You have all the benefits of a big city with a lot less of a hassle. So traffic really isn't a thing. I mean, you get mad if you have to wait for a stoplight twice or something, you're so upset. And if it takes you more than 15 minutes to get to work, you just can't believe yourself. So that part is super nice. There's lots to do. It has all the big city attractions like professional sports, tons of restaurants. It's also, it's kind of funny. I make this joke. Buffalo's like a resort town. People like roll their eyes, but in the summer, everybody's out boating on the water. And in the winter, everybody's like going skiing and doing snow stuff. I have a hockey rink in my backyard. So you get all the best of the environment. It's not just, under snow 13 months a year or whatever.